The right medication can save a life, but a medication that works well for other people might not work for you and may result in significant side effects. Pharmacogenomics is the study of how our genes affect the way our bodies respond to medications. Because of their genetic makeup, some people's bodies break down certain medications too slowly. The medication builds up in the body, causing severe side effects. Other people's bodies break down the same medication too quickly, eliminating it before it has a chance to work at effective levels. Yet others may be predisposed to have significant, sometimes life-threatening side effects from a medication simply from having the wrong genes. Scientists at Mayo Clinic are investigating how specific variations in genes affect how well certain medications work in the body. Using this information, doctors can examine your genetic profile to predict whether a medication is likely to help you or hurt you before you even take it. That's the promise of pharmacogenomics, providing the right drug for the right patient at the right dose. For example, if you have high cholesterol, your doctor might prescribe one of many statin medications to lower your risk of a heart attack. But these drugs also can have significant side effects. Finding that out can be expensive, time-consuming, and could delay receiving proper treatment. Pharmacogenomics offers a better way. A genetic test can show how your body is likely to respond to a certain statin. That helps your doctor prescribe the right dose of that medication, or even a different medication to get the best results for you. Today, a variety of genetic tests are available to patients at Mayo Clinic. One genetic test already available can help predict how an individual will respond to more than 30 types of medications. These medications are used in the treatment of heart disease, breast cancer, and psychiatric disorders. Researchers at Mayo Clinic are advancing this new science, identifying more genetic variations that affect the body's response to specific medications. Knowledge that can transform the practice of healthcare by incorporating this information into routine clinical practice. Find out how you can help Mayo Clinic bring the promise of pharmacogenomics to life for every patient, every day.
Hi, my name is John Iannone. I'm a medical malpractice attorney with Price Benowitz. When we're asked to review a case for potential malpractice, there are essentially three things that we are taking a look at. First and foremost, the law says that there needs to be a breach of the standard of care. What does that mean? That means that a doctor has done something that he shouldn't have done or didn't do something that he should have done in a person's care. That breach has to result in the second item that we look for, which is damages. That means that someone has been injured as a result of the breach of the standard of care. And thirdly, there has to be causation. That is to say that the breach caused the injuries. Very simply put, a doctor did something or didn't do something that resulted in injury to the person. Now, not every mistake or everything that a doctor does can be considered malpractice. There are certain things whereby the doctor is in a position to weigh certain options and to make a judgment. If it's a judgment call of the doctor, of the professional, of the expert, many times that may not be malpractice. Also, there are circumstances that in any procedure or in any treatment, there are known complications. If the suspected activity falls within a normal complication, then many times that may not be malpractice. So an experienced medical malpractice attorney will collect the medical reports, will look at the care and treatment rendered, and will make these distinctions to determine if in fact there is malpractice committed in this circumstance. If the malpractice has occurred in Washington, D.C., there is a process that must be filed before you can file your claim directly in court. You first must file a 90-day notice. That is, you have to serve notice and give the health provider 90 days before you can file suit. So if you are concerned about treatment you have received, call us and we'll be glad to help.